Orthopedic health information brought to you by Professional Orthopedic Associates.
Next, let's talk about treatment options with regards to managing the anterior cruciate ligament or ACL injury. Typically, when someone comes to an orthopedist's office to evaluate these types of injuries, they'll undergo a physical examination. In the office, depending on how much swelling there is inside the knee, we'll be able to determine the laxity or looseness of that ligament. Sometimes this can be difficult, particularly in the early stages, the first few days after the injury, because of the amount of swelling that there is. In more chronic injuries, it's typically easier to determine the degree of laxity. Treatment options, well, typically if there's any question whether the anterior cruciate ligament is torn, many orthopedic surgeons will recommend some type of a study, typically an MRI of the knee. An MRI is like an X-ray, but instead of showing us just bones, the MRI will show us the soft tissues of the knee, and with particular attention to the anterior cruciate ligament or ACL, it's very helpful for us to determine the degree of injury to the ligament itself. From there, we need to determine treatment options. Certainly not everybody who has an anterior cruciate ligament requires surgical treatment. Typically, patients who are low demand, typically older patients, may choose not to undergo surgery to repair this ligament. The treatment options at that stage of the game may include a strengthening program. We do know that by strengthening the muscles around the knee, that sometimes we can make up for some of the laxity of these ligaments. As well, braces are available. Okay? Braces can oftentimes help to control the instability of the knee such that a recreational athlete may be able to return to normal function and not have recurrent episodes of instability. The bigger problem comes in our young athletes who wish to return to some type of competitive athletic play. These are patients who typically don't do as well in a brace or with a rehab program alone. The more times the knee buckles or gives out on the person, the more likely they are to do more cartilage damage or injure other ligaments around the knee joint. So in this subset of people, we typically think more along the lines of a surgical reconstruction. Operations to fix the anterior cruciate ligament are been a very highly studied topic in orthopedics over the course of the last 30 years. We've learned an awful lot about this ligament and not only how to fix it, but more how to reconstruct the ligament and to give people good results as far as returning to sports. So let's get into what type of a reconstruction we do. Our surgical treatments initially were rendered around trying to fix the ligament itself, to suture it back together and repair it. The problems that we had with that was that we never were able to get the proper tension. The ligament never healed quite in the fashion that it was naturally put together. So we've basically abandoned those types of approaches and returned to something we call a reconstruction. Essentially what we do is we want to make a new ligament. We basically take a tendon or ligament from somewhere else, either around the knee or either from cadaver tendons, and we're going to reconstruct that ligament by making a new ligament. In the early stages of doing this, was done through an open, what we call an arthrotomy, where we open up the knee and do it. The advances now have brought us to the point where we can do this through some very small incisions, where we insert a camera inside the knee joint, which is called an arthroscopic surgery. Arthroscopic surgery allows us to see the inside of the knee and do the work that we need to do to reconstruct that ligament. Typically, the surgery itself requires drilling a hole through the bone both above and below the attachment points of the ligament, and passing a tendon graft across those two holes, and securing the graft into position in the bone both above and below the knee. There are lots of different techniques for accomplishing that, particularly with regards to what type of fixation is utilized, but the vast majority of surgeons at this juncture will utilize an arthroscopic approach to doing that. Let's talk about the surgery itself. Most of these operations are going to last about an hour to 2 hours. The surgery is usually done either under a general anesthetic or under what we call a regional anesthetic, where we anesthetize just that extremity. The surgeries are oftentimes done as an outpatient, so most people don't have to spend a night in the hospital to reconstruct their ACL. Most people will have the surgery, go home the same day. At the same time, this is not a minor surgery. It's not something that people are going to be back and doing all their normal things in 2 or 3 days. The vast majority of our patients are going to spend several days just concentrating on keeping the swelling down, using crutches to get around the house, and basically icing their knee. Again, some of the things that we've learned from the rehabilitation and recovery is that immobilizing the knee for too long is not a good thing. That scar tissue around any joint is not necessarily good for us. So whereas In years past, they were immobilized in braces and cast for 6 weeks after a surgery. Now we really feel like early motion is really key to restoring the knee to normal function. So within 7 to 10 days, we often are able to get patients off of the use of crutches and walking independently. Oftentimes we'll use a brace in the early stages for the first few weeks to support the knee, but most people can walk on their knee pretty normally within the course of 3 or 4 weeks.
This has been Orthopedic Health Information, brought to you by Professional Orthopedic Associates.